Greetings, this is Cindy Kennedy, and I'd like to invite you to subscribe to the podcast series at www.livingwithlyme.us. This will keep you up to date on all our new releases. Living with Lyme podcast guests may be discussing very controversial topics. The information contained in these podcasts are from the guests' personal experiences and are their own opinions. These podcasts are intended for information. The opinions expressed are solely the guest's own. Please discuss treatment options with your personal healthcare providers before changing or adding treatments. Enjoy the podcast.
Living with Lyme is brought to you in part by Doctor Inspired Formulations, a supplement company offering products such as liposomal artemisinin, liposomal oregano oil, and mimosa pudica. Patients can purchase without a prescription, and practitioners can open a wholesale account and carry the products in their office. To learn more, visit DrInspiredFormulations.com. That's DrInspiredFormulations.com. We'd also like to thank Hopkinton Drug. Many people have unique healthcare needs that mass-produced pharmaceutical medications just can't meet. That's why more people turn to Hopkinton Drug, a locally based compounding and wellness pharmacy. Whether it's Lyme disease, mold illness, thyroid, hormone replacement therapy, pediatrics, or dermatology, Hopkinton Drug's specially trained and licensed pharmacists can create customized compounded medications to meet your specific needs. Shipping is available nationwide. Go to rxandhealth.com. That's rxandhealth.com. Or call 800-439-4441. Hopkinton Drug, compounds with care.
Hi, everybody. This is Cindy Kennedy, and you are listening to another episode of Living with Lyme. We have a very recognized, admired, and compassionate speaker today, Dr. Tom O'Brien. He is a graduate of the University of Michigan and the National College of Chiropractic. He is on the board of chiropractic examiners and clinical nutrition. He's also a certified clinical nutritionist. He is a well-known author and visionary, and because it would take me another half an hour to go through all his credentials, go ahead and look at his bio for his amazing accomplishments. Today, we're going to learn about that naughty gluten. We're going to talk about autoimmunity and how to fix our brain in just 1 hour, which is his most recent book. It's my pleasure to give a warm welcome to Dr. Tom O'Brien, who is totally admired by me. Welcome to the show, Dr. Tom. How are you today?
Oh, thank you very much. I'm good. Thank you. It's a pleasure to be with you, and thank you for doing this show. You know, people need this kind of information. So kudos to you for what you're doing.
Thank you. Thank you. I do have fun. It's kind of silly how much fun I have. And it's great meeting people because it's great as resources. It's great to know what people have specialties in so I can, follow them or learn more information. So here, let's get right to it. I want to know the effects of gluten on most people's body and why is it such an issue?
Yes. Good. Well, there's no question about the effect. There are many studies. I have a full-day course for the general public and another full-day course for healthcare practitioners. It's called the Certified Gluten Practitioner Program. And there are 5 studies in that online course that talk about the impact of wheat. For every person, this happens to every single person. So, Mrs. Patient, your intestines are a tube. The tube starts at your mouth, goes to the other end, kind of winds around in your abdomen there a bit. It's one big long tube. If you think of a donut, if you could stretch a donut out, and just one big long donut, you look down the center of the donut, that's your digestive tract. That's your intestines. So when you swallow food, it's not in your body, it's in the donut. And the food has to go through the walls of the donut to get into the bloodstream. Now, the way that happens is that the inside of the tube is lined with cheesecloth. So only really small molecules can get from the tube through the walls into the bloodstream. And that's the job of our enzymes, our digestive enzymes, is to break food down into smaller and smaller pieces. You know, if you think of a pearl necklace. Hydrochloric acid that's made in your stomach undoes the clasp of the pearl necklace. Now you're holding a string of pearls. And our digestive enzymes act as scissors to snip that necklace into smaller clumps of pearls. Smaller clumps, smaller clumps, smaller clumps, snip, 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 until you get down to each pearl of the pearl necklace. That's called an amino acid. And each amino acid is small enough to go through the cheesecloth to get into the bloodstream. Then your body uses the amino acids to make new proteins, new hormones, new bone cells, new brain cells. That's the raw material that we make our new cells from, is amino acids. So until your food has been broken down small enough, it can't get through the cheesecloth inside the tube to get into the bloodstream. The problem with wheat is that no human has the enzymes to break down wheat into each pearl of the pearl necklace. No human. And it tears the cheesecloth for everyone, because these peptides of wheat, these partially digested peptides of wheat, are inflammatory. They cause inflammation in the intestines, which tears the cheesecloth. And that happens for every human. Harvard's published this.
You know, people want to know, when you say it causes inflammation, what is that actual activity at the cellular level?
Well, you're okay. Let's do a deep dive.
Well, okay, let's go. You got it.
You bet. The main cytokine this produces called interferon gamma, and those levels go quite high when wheat is dropped through the stomach into the small intestine, going down the tube. So interferon gamma is created, which is the signaling molecule that increases NF-kappa B, which is the amplifier of inflammation in the body. It is the amplifier, NF-kappa B. So interferon gamma triggers the production of NF-kappa B, which activates the whole inflammatory cascade.
Okay.
And it happens to every human every time they eat wheat. Within 5 minutes of wheat coming out of the intestines, or I'm sorry, out of the stomach into the small intestine. So you eat toast for breakfast. You tear the lining of your gut. It's called leaky gut. This is leaky gut. You tear the lining of the gut, but then it heals. Mrs. Patient, you have an entire new body every 7 years. Every cell in your body regenerates. Every cell. Some cells regenerate very quickly, like the inside of your gut is every 2 to 3 days. You have a whole new lining to your gut. Some cells are very slow, like your bone cells and brain cells are slow. But every 7 years, you have an entire new body. So you eat wheat, you tear the lining of your gut, but it heals. You have a sandwich for lunch, you tear the lining of the gut, but it heals. You have pasta for dinner, you tear the lining of the gut, but it heals. Day after week after month after year, until one day, and this is the kicker for everyone, this is really important. One day, you don't heal anymore. Now you've got pathogenic intestinal permeability. The slang term is the leaky gut. So when you don't heal anymore, you tear the cheesecloth again, but it doesn't heal. Now, when you eat food of any type, and you're breaking down these molecules into smaller pieces, you know, that's one reason why your intestines are 20 to 25 feet long, is because it takes a whole lot longer to break down prime rib than it does a banana. And so you're breaking these molecules down smaller and smaller and smaller. But when you have tears in the cheesecloth that don't heal, larger molecules can get through the tears of the cheesecloth into the bloodstream before they've broken down small enough to get through the undamaged cheesecloth. So they go through the tears in the cheesecloth. Those are called macromolecules. Now, if that macromolecule is a tomato that hasn't been broken down small enough yet, but a piece of tomato gets into your bloodstream, your immune system says, whoa, what's this? I better fight this. This is not something I can make new bone cells from. Now you make antibodies to tomatoes, and now you're allergic to tomatoes, or to oranges, or to couscous, or to eggs, or to soy. It doesn't matter, the food. When a macromolecule gets through into your bloodstream, your immune system, trying to protect you, is going to get activated. So that's the person that does a 90 food panel, blood test. They'll see what foods are you sensitive to, and it comes back and they're sensitive to 20 or 25 different foods. And the person says, oh my God, that's everything I eat. Well, of course it is.
Right.
Your immune system's trying to protect you.
Right.
It's doing what it's supposed to do. The food's not the problem. The problem is you've got tears in the cheesecloth or leaky gut. So that happens every time you eat wheat. And it heals, and it heals, and it heals until you lose oral tolerance and you don't heal anymore. And it's the loss of oral tolerance is why wheat sensitivities keep getting more and more common. And more people are losing the ability to heal from the minor tears in the cheesecloth.
Do you think it has anything to do with the prominence of glyphosate in our wheat and corn and whatever, plants?
That's a really good question. It's a common question. And some doctors will say, it's the glyphosate. No, it's not. But glyphosate is a contributor. It's absolutely a contributor. Yes, it makes it worse. There's no question it makes it worse. The studies are very clear. Glyphosate kills the good bacteria in your gut. And when it damages and alters the good bacteria in your gut, now you have a much more vulnerable inflammatory environment for a bonfire to take off. So absolutely, glyphosate makes it worse. Absolutely, glyphosate is not the cause. It is one cause.
Yeah.
It's one cause.
And we can see that because all of this has progressed. You think of it like people will tell me, when I talk about this, they'll talk about how come I could go, when I was in Italy and I had the pasta, I really didn't have any symptoms. And I wondered a little bit about it. What's your thoughts on that?
Well, you're asking really good questions. So that's another question that's important for people.
Thank you.
Yes. So wheat is made up of many different parts. Gluten is one family of proteins that's in wheat. But there's other components of wheat that also can trigger an immune response. They're called glutenins, gluteomorphins, wheat amylase trypsin inhibitors, FODMAPs. There are many different components of wheat there's 62 different components of wheat that may trigger an immune response, not just gluten. Gluten's the most common one. It's a very important one, but it's not the only one. That's why most of the tests that doctors do are incomplete when looking for a sensitivity to wheat, because all they're checking is gluten. And gluten's important to check, but it's only one of 62 possible components of wheat that can cause the problem. So we now know the Italians have done a lot of research on this. And in Italy, there are 36 centers that are certified by the government. They're called gluten-related disorder centers. And if you get a diagnosis of a wheat-related disorder from one of these centers, there's 27 that are gastroenterology, 4 that are pediatric, a couple general medicine, a couple allergists, these centers. If you get a diagnosis from one of those centers, your food is a tax deduction. So the government recognizes.
Wow.
Yeah, you bet. You bet. That's why for anyone that's going to Italy, if you're going to get a bed and breakfast or an Airbnb and you're buying your own food to cook, you go to the pharmacy to get your gluten-free products. And you just walk into a pharmacy and you say, I'd like to order some pasta gluten-free, and they'll have it for you the next day, fresh. And cookies and croissants and whatever you want gluten-free. But there were 5, I think it was 5 centers got together and published a study. They looked at thousands of people who had been sent to them. And 7% of them were celiacs, 93% of them were wheat-related disorder patients. So they had something other than celiac disease that was causing their problem. And what they published was that it's the gluten proteins cause a lack of well-being, meaning you got brain fog, or you got joint pain, or you got chronic fatigue, or you got kidney problems or bladder problems. But it's the FODMAPs in wheat that cause the bloating and the gas and the abdominal discomfort. Most of the time, it's the FODMAPs. It's not the gluten. So why can people eat wheat in Italy and say I feel fine? Well, they're associating bloating and gas and abdominal pain with when they eat wheat in the U.S. They don't get bloating and gas and abdominal pain in Italy because the wheat over there is lower in FODMAPs. But it has the same amounts of the gluten proteins that trigger the immune response. So we've had a number of patients who say, oh, I'm going to Italy, I can eat the wheat. I say, no, you can't. Oh, no, doc, I feel fine when I go, listen. And I explain all this to them. And I say, so here's what we do. We do the blood test now. Because Mrs. Patient, we did a blood test 9 months ago. It came back positive. You gave up all wheat. You're doing great. You feel better. Your life's better. All the complaints you had are gone. Great. We rechecked and blood test was normal. Great. Everything's working. So now we know that you don't have any antibodies to wheat. So let's do the test again to make sure that you're still in that shape, in that condition. Go to Italy, eat all the wheat you want, and you won't feel bad because it's lower in FODMAPs. Then when you come back, we'll do the blood test again. And now you'll see that all of the antibodies are back, and the antibodies to your thyroid are back, or the antibodies to your brain are back, and the immune system's activated. You just didn't feel any stomach problems when you were eating the wheat, but it triggered the immune response, just like it did before.
You know, I know of the FODMAP diet, but I actually did not know that that was actually kind of a component. What does FODMAP stand for?
FODMAPs are fermentable carbohydrates.
Oh.
They're components of many different foods. Beans, lentils, chickpeas. If you go on Google, just type in list of FODMAPs, you'll see there's lots of foods. Apples, lots of foods have FODMAPs.
Wow.
They're not bad for you. They're not bad for you unless you have a FODMAP sensitivity. If your body has a FODMAP sensitivity, you can't eat FODMAPs.
Okay.
It's not rocket science.
How do you know? How do you know? Is it? Yeah. Go ahead.
Yeah, there's a test called the wheat zoomer. Oh. And it's the most comprehensive test out there because it zooms in on the problem. There's no test that matches the wheat zoomer. That's the one that you do anytime you want to know if you have a problem with wheat, because it looks at 26 different components of wheat, and it's very, very accurate in its reporting. It's very accurate. Mayo Clinic has written 2 different papers and called this a new era in laboratory medicine. And I call it the 30-30. 30 years ago, it would have taken a room 30 by 30 at MIT, floor-to-ceiling computers, to generate the computing power of your smartphone. A 30 by 30 room to do what we can do on our smartphones. I can find out the particulate matter in the air in New Delhi, India, in 5 seconds. Right?
And why do you want to do that?
Right. Well, I talk a lot about air pollution and things, but the point is the technology has improved so much. So we could not have imagined 30 years ago that we'd be able to have a phone, not only to call anybody in the world that we want for free, but also to dial in and look at different aspects of life and knowledge and what is it that we want to know about. So that same level of technology is available now in laboratory medicine. It's a game changer. There's nothing like it out there, the wheat zoomer test. There's nothing like it. And it's just remarkable to see the results. And Mayo Clinic calls it a new era in laboratory medicine.
Wow. There's a neural zoomer as well, correct?
Exactly.
Yeah.
So there are like 8 or 9 zoomers, and they're all of the same degree of accuracy. And
who does this test? What lab is responsible?
The laboratory is called Vibrant Wellness.
Yes.
And we've never seen anything like it. And many laboratories are feeling quite threatened. And they're trying to say something negative about Vibrant Wellness. And I don't know the politics, all that, but I trust when Mayo Clinic writes papers, publishing papers saying it's a new era in laboratory medicine, this is a game changer. I'm listening to what they're saying. And so
well, everything has become so complicated. No one has something simple. It's right. Very rare that, by the time people get to integrative, functional health people, they've gone through a myriad of specialists, etc. And, right. Right now I'm dealing with a lot of people that everything started for them in the gut, right? It's exactly. And people think that, you have to just look at my blood counts. And, people can look like stellar health on regular lab tests, but they're still suffering. And
well, we have to understand that the regular blood tests that you're referring to are really good tests. And they were designed 30 and 40 years ago to identify disease. And, my favorite patients are the ones that come and say, I've been to Mayo Clinic and they don't know what's wrong. And that's great. Congratulations. And I always do it like that. They think I'm a little off anyway. That's fine.
Yeah,
say,
perfect.
But that means you don't have a disease. Because if you had a disease, Mayo Clinic would find it. You've got dysfunction. Something's not functioning right. So we're not going to do disease tests. You've already had those done. We're going to do functional tests to see what's not functioning right.
Oh, I like this. Can I steal this?
Of course you can.
All right. I'm going to write it down. Go ahead. Keep talking.
Yes. Well, and when those tests come back, so they do the tests and they're saying, oh, that just makes sense. And they do the tests. And when those tests come back, the second visit, they come in and they're already feeling better because they've gone wheat-free, dairy-free, sugar-free, which is a prerequisite in our office. Everybody does that. And then when they come back to the second visit, everybody's a little nervous about test results. They're a little nervous to hear what the status is. We worry things like, do I have cancer or something like that, sometimes subconsciously, and that's understandable. So I look at the test results and I say, good news, you're a mess. They look at me and I say, look at all these things that are wrong. What's good that we found this, and this is all fixable. This is all correctable. These are functional things that are out of balance. And this is what we do for this. This is what we do for that. This is what we do for this. That's the whole platform of my friend, Dr. Dale Bredesen's book, The End of Alzheimer's. And, he runs the Buck Institute at UCLA, the Alzheimer's Research Center. And he published, we've got hundreds now of people who have reversed cognitive decline and mild to moderate Alzheimer's, their diagnosis. They're reversed. They're back to work. Because his analogy, and this is true with Lyme, this is true with chronic fatigue, this is true with any degenerative condition. Imagine you've got a factory. There's graffiti on the wall. There's 37 holes in the roof. And the rain has created puddles on the floor. All the lights it's dark in there. That's your brain with Alzheimer's. That's your brain. There is never going to be a pill to fix that. There's never going to be a pill to fix Lyme disease. There is not. There's 37 holes in the roof with Alzheimer's, and with Lyme, I haven't counted. There's just a bunch of holes in the roof. And what you have to do is you have to check all 37 mechanisms, 37 biomarkers. Do they have elevated homocysteine? Fix it. Do they have a sensitivity to wheat? Get it out of there. Do they have a sensitivity to dairy? Get it out of there. Do they sleep 7 to 8 hours a night? Teach them how to sleep better. Do they walk every day or exercise? Show them how to do that. That you have to just go back and reteach the person how to live their life in a non-toxic way to their body. Then your body, because every cell in your body regenerates, and you just want to start regenerating healthier, stronger cells. And that's the way that you address Lyme disease. That's the way that you address Alzheimer's. So the book, The End of Alzheimer's, goes through all of this. And what they talk about is true for many different diseases, not just Alzheimer's. So the concept is the same. You look for the biomarkers that are out of balance and you fix them.
Yeah.
And what you notice is you start feeling better.
Right. And it doesn't take that long.
Correct.
We'd like to take a moment to thank our sponsors. Botanical medicines are an important part of the Integrative Lyme Disease Program. Biocidin from Biobotanical Research is a professional strength broad-based program that has been extensively researched for effectiveness as nutritional support in Lyme and co-infections. Ask your practitioner about Biocidin LSF and visit biocidin.com. Master Supplements specializes in probiotic enzymes and fiber that support digestion. Their products provide results that you can feel working within 60 days or a money-back guarantee. Their staff is available to help you decide which products and programs are right for you. Visit master-supplements.com or call 800-926-2961 for more info.
We talked before the podcast started, and we talked about people really want something to fix it today. They want to walk out with a piece of paper, go to the pharmacist, get a prescription, and a lot of people will stay on the prescription for the rest of their life if it works for them. And people aren't committed. I don't know about you, but I do find there's a section of people that are just not committed to make the changes. And when you send them out of the office and you say, okay, these are the 3 things I want you for the next 6 weeks. I don't want you to have any of this. And you've gone through the explanation, of what it's doing, etc. And then they come back and they say they're not better. And I guess they don't expect you to ask the question, well, did you? And oh, well, I tried, but I just couldn't. And then you just want to go, why not?
Right. Well, yeah. My approach is that those people need more hand-holding. That we gave them a sheet of paper and said, do this, this, and this, and we're asking them to change the basic way they live their life, and that's so difficult for people to do. And so it's important that people work with registered dietitians, nutritionists, health coaches who walk with them. Excuse me, who walk with them through the natural food store and show them the taco sauce that's safe to use, and show them that instead of imitation butter, regular butter is great for you, and this is one that's organic. Who shows them all the little things and gives them, say, listen, give me 2 breakfasts a week with no wheat, and here's some recipes, and try this and try this. And after a couple of weeks of being successful, give me 4 mornings a week and 1 lunch a week. And here's a couple of recipes. And people who are not competent, I shouldn't say competent, people that don't have experience with changing the way they live their lives, if it's just so new for them, you have to baby step them. And when you do that, but you have to explain, now, if you want to get well quickly, we have to do this right away. But if realistically, if you find that you're going to be cheating, let's just make it a little longer plan and know that it's going to take longer. Don't expect immediate results if you're giving 50% effort.
Got it. That's a good point. That's a really good point, because I have a patient that I was carrying some things out, and we talked. His wife gave us some information that he is a freak about Diet Coke, I guess. And so he goes, just put it in the back of the truck. So I opened up the back of the truck and out rolls the 64-ounce bottle of Diet Coke, as well as the other 4 of them that are sitting on the floor. And he goes, I promise. So I go, boy, you got found out that, real easy. Maybe next time you want to carry your own stuff out to the car, right?
Yeah, right. So, you got picked off.
People love crunch. And I understand that crunch is actually good for your brain. I read that once. But they love crunch. And outside of vegetable crunch, they like, something with a carb crunch. Are there any grains that you like? Are there any snack products that you like?
Quinoa is an excellent grain to use. It's higher in protein. The problem is sometimes it can be contaminated, like any grain can. But quinoa is really great to use. Safer. A lot of people, when they go gluten-free, they'll do a lot of rice. And rice has been around for many, many years. The problem with rice now is that it tends to be really high in arsenic.
Oh.
And that's because, rice lives in a little bit of water, rice paddies and where rice grows, it's in water. And the irrigation water is loaded with the arsenic that's been in the insecticides and pesticides sprayed on the fields for the last 30 years. So the arsenic has accumulated and it's in the water. And so rice growing in the water can be high in arsenic. And so there is some concern about the level of heavy metals in rice and some caution now in being expressed in eating rice too frequently. And it's because we've poisoned it. We've poisoned the planet. Oh. It's not that rice is bad for you. It's that the environment that it's grown in is bad for you.
I know.
So
it seems hard, it seems hard. Even if you said, okay, I'm going to move out to the middle of the country. I'm going to find myself a plot of land. I'm going to start, cooking for myself and growing my own stuff. I mean, the land is difficult. I don't know what else to do. I mean, it used to be very nutrient dense, yes. Our soils, and either they're over farmed or they're contaminated with pesticide. And people don't realize, your organic stuff, it's completely perfect. Well, it isn't, because you only need a 6-foot buffer between, Farmer Tom, let me change the name, Farmer John's pesticide-ridden corn, and then, Farmer Annie over here, who's completely organic. Yes. It's in the air. It's very difficult. And then we also know that some of our fruit and vegetables are contaminated with mold, and they really don't. People think they'll last, a week in the fridge. Well, truly they don't. And I know what happened to you once. I heard that you got up in the middle of the night one time and you were wanted a snack. You reached in the refrigerator, you pulled out some berries of some sort, chomped them down, yes. Right? Yes. And then in the morning when the light was up and shining, the sun was out, you went in and you're like, these are all moldy.
Right.
But because your immune system is up to par, your body probably processed that and it didn't bother you. Whereas other people, if they're repetitively ingesting that can set off a whole litany of issues, right?
That's exactly right. Yep.
Yeah, that's tough. That's really tough. So
the strength of your microbiome determines your health.
Right.
Across the board. The bottom line, the very bottom line. You want to be healthy, you need a healthy microbiome.
Right. And people hear that term and they're not sure of what microbiome, but we're really talking about your intestinal health, your stomach, all the way down through the exit. Right?
Well, the inside of the tube. What's in the tube. Inside of the tube? What's in inside? What bacteria? What viruses? What bugs? What parasites?
Right.
What's inside the tube?
Do you like stool analysis?
Yes, of course, yes. And the technology has gotten so much better than in the past. So it's a great general screen. And sometimes, depending on the type of stool analysis you're doing, can tell you a whole lot about the composition of your microbiome.
Right. One of the things I heard negatively about it, and I don't know if it's just kind of an oversight, but a I heard from someone that I actually have followed that you shouldn't put a lot of credence in it because it's actually what's being brought into the stool and being eliminated. So it might not be a really perfect test. I don't know how I feel about that.
I'm not sure what is meant by that. What you're looking for in a stool analysis is what's in the stool, what's there.
Yeah.
So if there's a whole lot of a toxic bacteria like Klebsiella pneumoniae, Klebsiella pneumoniae is the most common infection that people get in hospitals in their lungs, causing pneumonia. And it's very common to find high colonies in the gut. You do a stool analysis and they're high in Klebsiella pneumonia. That person's got a problem. Either they've got asthma, they've got sinus problems, bronchitis, history of pneumonia. But their lungs is a place where that bacteria loves to live and to thrive. And stool analysis can tell you sometimes this person's body is loaded with Klebsiella. And then you have to do a protocol to wipe out the bad bacteria. It's a very useful test for that purpose.
Yeah, I like that. I've heard you speak before, and you crack me up because you say the fire in the hole. What do you mean by the fire in the hole?
Fire in the hole. It's inflammation in your gut. And it's inflammation in the gut that causes the tearing of the cheesecloth, the leaky gut that allows the macromolecules to get into the bloodstream. And then your immune system, trying to protect you, fights the macromolecules, making antibodies to the macromolecules. The problem is those antibodies to the macromolecules, they're special forces soldiers. And they've got high-powered rifles, and they're going after a very specific enemy. They're targeting this bacteria, Klebsiella, as an example. They're targeting Klebsiella, and everywhere they go, they fire their chemical bullets when they see Klebsiella. Now, the blood goes everywhere, and your bloodstream is just a highway. There's lots of traffic, but there's no lanes. Everything's bouncing into each other. There's no organization that's just all going the same way. So you've got these antibodies going around looking for Klebsiella in this example. This is really important with Lyme, that these antibodies are going around looking for Klebsiella in this example, firing their chemical bullets. The way they identify the Klebsiella is that they look for a particular protein signature. Think of it like a vest, and they're looking for orange vests. And it's a protein signature, but they're looking for orange vests. And everywhere they find that protein signature, they fire their chemical bullet. The problem is much of your tissue in your body includes orange vest. So that the amino acid structure of your thyroid, of the myelin that surrounds your nerves, of your brain tissue, includes the amino acid sequence of the orange vest. So the antibodies going after Klebsiella start going after your thyroid. They attack your thyroid if that's your genetic vulnerability, or they attack your brain if that's your genetic vulnerability. So now you've got antibodies to your brain, to myelin in your brain, or to the cerebellum in your brain. These different areas of the brain, doesn't matter which one it does for the symptoms, but the mechanism is the same. So the antibodies that were going after Klebsiella to protect you, and the term is called molecular mimicry, that the molecules mimic or look like Klebsiella, but it's your thyroid or it's your brain tissue, but the signature is the same. Now, the one that people can understand for this, for molecular mimicry, is, and most people don't know why, but dentists often give antibiotics when you go to a dentist. Why do they do that? There's only one reason why. As far as I know, there's only one reason. When the dentist is working in your mouth and they squirt water in your mouth, and then you swish it around, then you spit it out in a little porcelain bowl there, and it's red water or pink water, that's blood. The dentist has given you leaky gums. you got leaky gums now. And it takes 2 to 3 days, like leaky gut, leaky brain, leaky gums. It takes 2 to 3 days for the leaky gums, for the gums to seal on the teeth again. So for a few days, you've got leaky gums. Now, the oral microbiome, the bacteria in the mouth, there are hundreds and hundreds of families of bacteria in everyone's mouth. Strep, staph, Klebsiella, Proteus. There are many different kinds of bacteria in everyone's mouth. That's being human. Everybody's got that. So now you got leaky gums. If the strep bacteria gets through the leaky gums into the bloodstream, just the same way macromolecules go through the leaky gut, if strep bacteria gets through the gums into the bloodstream, and if that strep bacteria starts to colonize, finds a place to hang out, like binding onto some tissue and starts to colonize, now your immune system gets activated to fight the strep. So here come the special forces soldiers looking for the orange vest of strep, and they fire their chemical bullets. Now those soldiers in the bloodstream, they're going everywhere looking for strep. The problem is the orange vest of strep looks just like the valves of your heart. So if you make antibodies to strep, you are at risk of those antibodies attacking the valves of your heart. That's rheumatic fever. That'll kill you. That is the only reason that dentists give antibiotics, is because if you have antibiotics in your bloodstream, then the dentist gives you leaky gums, a little strep gets through, but the antibiotics are already there to kill the strep so that your immune system doesn't get activated trying to protect you. There's no need because the antibiotics kill the strep. That's why they give you antibiotics, because of molecular mimicry, to prevent molecular mimicry. Now that concept of molecular mimicry occurs all day, every day. You have a sensitivity to wheat, you make antibodies to wheat, you're going to make antibodies to your thyroid, or to your brain, or to your liver, or to your bones, or to your joints. Just depends on your genetic vulnerability and what kind of environmental exposures you've got.
Okay, I have a question. Okay, so if you're making specific antibodies to wheat, and it looks like, say, a piece of a puzzle. However, you're saying that because of this, you get molecular mimicry, and then that ends up, are these antibodies now changed to be specific? Because, we can, for thyroid especially, we can do a blood draw and actually test for those antibodies. So you're saying they actually convert to the specific antibody against the thyroid?
Well, that's a really good question. So what happens is the antibodies to wheat attack the thyroid tissue. The damaged thyroid cells now have to be cleaned up and gotten rid of to make room for new cells.
Got it.
And so you make thyroid antibodies to get rid of the damaged thyroid cells.
That's cool. That's cool. What do you think about someone who has suffered from Lyme disease for many, many years, had been treated, but has developed a terrible neuropathy to the point where, they've had biopsies and showed degenerative nerve damage, and is having a real devil of a time because it's progressing, and we haven't really gotten to the root of this to help him.
Yeah.
So that's an antibody, you think, right?
That's a very common mechanism that you see. Yes, it is. And the mechanism is usually molecular mimicry. So you have to do the functional tests to find out what is your immune system trying to protect you from, and why. And then it likely will tell you why your immune system's attacking your nerves, because it's trying to protect you from wheat or from dairy, or you got a Klebsiella infection or a Proteus infection. And then you've got elevated antibodies to myelin, the saran wrap around your nerves. And when you get rid of wheat or dairy or eggs or soy or whatever the food is, or the heavy metals that you've got, or the phthalates, the chemicals from plastics, you have to find out what is it that your immune system is trying to protect you from.
What about
Because,
heavy metals? What about
of
heavy metals?
course, of course, of course,
Yeah.
because your immune system is the armed forces in your body. There's an Army, an Air Force, a Marines, a Coast Guard, a Navy, IgA, IgG, IgE, IgM. You know, it's when your immune system is activated, it's not an immune system gone crazy. It's not like the old videos, Girls Gone Wild, in Florida.
Spring break?
Exactly. It's not like that. Your immune system is trying to protect you from something. So the question is, what's it trying to protect you from? And when you dial that down, when you find out and you address that, then the peripheral neuropathies tend to reduce. There's so many studies on this associated with wheat. People that have peripheral neuropathies, but they don't have, when they do the EMG tests on them, the EMG tests are normal. Well, the EMG tests are looking at the large nerves of the body, of the arms and the legs, and they can come back normal. Well, it's because the large nerves aren't affected. It's a small fiber neuropathy. And the small fiber neuropathy, they've done punch biopsy. They take a little tissue from the arm and the forearm and the thigh and the leg, and they look at it under a microscope, and they measure, and just below the surface, just below the skin layer, and they're looking and they're measuring the number of nerves that are in them. They show you pictures. Here's a normal, and you count like within 1 centimeter of tissue. You look for nerves 1, 2, 3, 4, 5, 6, 7, and you see the nerves. And then they show you a person with a small fiber neuropathy from celiac disease. And you look and, wait a minute, there's only 3 nerves here. In that same amount of tissue on that person, as in a normal person, there may be, I'll make up 14 nerves that you see in a little block of tissue. Well, in a celiac, you see 3. That's small fiber neuropathy, and that's the peripheral neuropathies that people get. So you have to find out
terrible.
What is your immune system trying to protect you from? Because in one study, 50% of those people got better when they went wheat-free.
Right.
They got completely better.
Yeah. But sometimes it gets frustrating because you do your functional testing and the person is diligent about eliminating these inflammatory items in their diet, but we still haven't gotten to the root cause. And that can be difficult because you either lose your patients because they think you just don't know what you're doing, or they go on. And, we do know that a lot of people who suffer from Lyme disease really can't handle either the pain or the isolation or whatnot, and they get extremely depressed. And that leads to things like suicide. And that is one of the saddest things you can imagine, because we're talking about an infection that has caused so much controversy, and regular mainstream medicine, they've just turned a blind eye at this, and trying to get people to diagnose people based on clinical findings is very difficult. And I don't know what is going to change their minds, and I don't know if it really has to go all the way back to medical schools.
Well, there's enough people out there that need the help and want the help. That you focus on the people that you can help. And it's unfortunate there are some people that just don't want to change or are resistant to change, even when you give the best service possible, and just pray for them and hope for the best. But there are enough people that need the help and want the help to keep you very busy.
Right. And, it's funny because when I spoke with Dr. Neil Nathan, he had a whole episode. I'm sorry, not a whole episode, but he had a whole segment of our talk that he talked about these people. And he taught me something. And it's not so much that these people are belligerent or, they're problem patients, although, some are, but it's people who are just not ready. They're just not ready to make that change. And being everything is in the way you say something to a patient. And if you broach that subject in a gentle way, with a lot of compassion, and you say, you know, I'm really trying my best here. And I talk to every one of my patients, and Dr. Moorcroft gave me this idea. And what I say is, I'm going to build you a toolbox. I'm going to put everything I can do for you in this toolbox. Once it's filled, I'm going to close it and lock it, but I'm going to hand you the key. I no longer have the key to that box. It's filled. Every tool that you need to get better is in that toolbox, and you really need to utilize that toolbox in every way that has, you know, that information in that toolbox. And I think that's important. And, you know, by telling people they have control. You know,
Yes.
People need control. And by saying, you know what, you've hired me. I'm here, you know, just like you're the Sherlock of all these kind of things. You're trying to get to the bottom of it. But by being able to say you're in charge, sometimes really gives the people the ability to make their change.
Well, that's a marvelous way. That's a marvelous summary to conclude with, is by giving people toolboxes, and for them to understanding it's their tools to use. And the more they use them, you know, you make something, it doesn't come out right. You know, I'm learning. All right, I'll make it again. You know, so you cook a meal with quinoa and you burn the quinoa. Okay, you don't not make quinoa again. You know, right? You say, all right, you know, I'm on a learning curve here. And for all of us, we're on learning curves. So the goal is to just give people as many tools as possible that are relevant to their condition, relevant to their particular situation.
Yeah, I think that's a perfect ending to a fine interview. But I do have to ask you a couple of questions. And, you know, we're dealing with Lyme, we're dealing with ticks and whatever. I just want to know, Dr. Tom, what ticks you off?
People who hurt other people.
Okay. Intentionally.
People who are rude. People who are just short for no reason with others.
Yep. And you know what? It's all about being mindful and treating people the way you'd want to be treated. And
Yes.
I have, you know, in my whole journey with Lyme disease, I can tell you that every time we went into a new provider, that first meeting, it looked like it was going to be great. This is it. The second meeting wasn't so great. And that's unfortunate. Now, in life, we do get lemons. You know, we burn our quinoa, but we do get lemons, and our choice is either to become sour or we can make lemonade. What do you think? What do you think your lemonade is?
My wife and my kids.
Oh, I love it. Will she listen to this? Because this is kudos for you.
Well, I tell her every day.
Oh, I'm so proud of you. That's so important. And it sounds like you're very mindful in the way you deal with your patients and the way you deal with your family. And
we really try. You know, I'd recommend everyone that's listening to this, if you read my two books, The Autoimmune Fix and You Can Fix Your Brain, you'll have this big picture overview and will understand how to begin addressing your Lyme disease or whatever degenerative disease you have. It's the big picture overview you need, and you'll appreciate the recommendations that you're getting from your healthcare practitioners.
That's awesome. That's awesome. Well, thank you for being a guest, and I'm sure this whole podcast is going to be reviewed and re-listened to, because there's just a tremendous amount of information, and people do need that information. So thank you again.
Oh, it's my pleasure. Thank you very much. And thanks for doing the work that you do.
Oh, I appreciate it. For everybody listening, this has been Dr. Tom O'Brien, and you've been listening to a Living with Lyme episode, and we've covered a lot of information here. This podcast is in part sponsored by Pursue Wellness. You can find the information online at www.pursuewellness.us. And it is a nurse practitioner, myself, and a registered dietitian, Kara, practice. And we look forward to helping people with chronic issues, just like Dr. Tom O'Brien does. Everybody, take good care and enjoy your day.
Thank you for listening to another episode of Living with Lyme. We'd like to take another moment to thank our sponsors. Botanical medicines are an important part of an integrative Lyme disease program. Biocidin from Biomechanics Research is a professional strength, broad spectrum formula that has been extensively researched for effectiveness as a nutritional support in Lyme and co-infections. University studies have shown that this combination of plant medicines is also effective on biofilms that may be hampering treatment, as well as providing broadly acting herbal support. The liposomal form of biocidin, called biocidin LSF, is used by Lyme literate physicians such as Dr. Richard Horowitz and Dr. Jill Carnahan. Ask your practitioner about biocidin LSF and visit biocidin.com for more information. Master Supplements. Does living with Lyme ever get overwhelming and finding the right support seem difficult? Well, Master Supplements can help. Master Supplements specializes in probiotics, enzymes, and fiber that help support digestive and immune health during and after antibiotics. Master Supplements products provide results that you can feel working with a 60-day money-back guarantee. Their staff is available to help you decide which products and programs are right for you. Master Supplements is dedicated to science-based products with the highest standards of quality control. Visit master-supplements.com for more information or call and talk to a team member at 800-926-2961. That's master-supplements.com or 800-926-2961. Thanks so much again for listening to Living with Lyme. We'd like to remind you that if you have not done so already, please subscribe to the podcast. You can visit our website at livingwithlyme.us so you make sure you don't miss any episodes. Until next time, thank you so much for listening, and we'll be back soon with a new episode.